Hi, Alex Watson here, Oscar Consultancy, the Clinical Director here, and we'll be talking this month in this newsletter about neck pain. Or actually more specifically, we'll talk about spasms in our neck, or people feel like they have trapped nerves in the neck. Actually, quite often people think they've got a trapped nerve, but actually they just got a sharp spasm of a muscle in their neck. If you actually had a trapped nerve, you'd get pain in the side of your neck and across the arm and potentially down your arm into your hand, and you can have tingling and or weakness in your hand and arm. That would be a trapped nerve, but most people actually come in with a trapped nerve, which is actually just a spasm section in their neck. That can happen for multiple reasons. It can be a postural mechanical problem. You could have ergonomic issues where you haven't set up in front of your computer correctly, using your phone or tablet too much for a funny angle, not having your elbow supported at a desk, sleeping funny, in a poor sleeping position, or actually sleeping funny because you slept in a funny, in an awkward position is unusual for you. Lots of times that you have underlying mechanical problems that might have come on to cause it, arm issues and shoulder positions and posture. All these things can contribute towards getting neck problems. So what can it feel like? A neck spasm is often where your neck spasms and tightens up and locks into that side. You could actually have a facet joint problem on this side, and that's the sort of joint in your neck that starts to overstrain, and for whatever reason the muscle starts to spasm on that side, and it can be quite severe. Sometimes actually you can end up with the joint problem on the opposite side, and because of the joint problems on this side, the muscle clamps down on the other side to drag your body away from that side, so your neck's avoiding it. So you can see there's quite a few things can lead to neck problems, and it can come with, headaches and stuff as well. And it's important to understand what the diagnosis is, what the tissue causing symptom is, but most importantly is why have you got the problem, because if we don't understand why, then sometimes you can do some exercises of your neck and it might help in the short term, but we don't get to the bottom of it in the long term. So some gentle mobilisation exercises and a nice stretch can help mobilise it and take some pressure away. So when you do those sort of stretches, you want to feel a stretch on the other side, but not on the same side. So if you feel it on the same side, that's probably the joint, and you need to stretch it going the other way, and that will gently start to move it up, move it, make the range of motion improve. Heat, some painkillers if it's appropriate for yourselves, and that will help get you moving. But the most important thing is don't panic, because most of the time people can get in severe pain when their neck goes into spasm, and they start to panic and then they tighten themselves up even more. So number one, relax. If appropriate, take some painkillers. You try some heat, that often helps. Start to mobilise your neck, so nice and gently and stretch. And then last and most importantly, give us a call. See you next month.